All right, so our topic is going to be childhood anxiety. It's going to be by myself, Danny Lee, and my partner, Amy Sanko. A quick overview of what we're going to be looking at today: the introduction, the etiology, medical management, the role of OT, our fictional client, our intervention, references, things of that nature. All right, so childhood anxiety disorder is a psychological condition characterized by excessive and persistent worry, fear, and apprehension. Um, and it's completely irrational, usually. Um, it interferes with a child's daily function. The most common subtype of anxiety disorder for children, there's a lot, but the most common was going to be generalized anxiety disorder. This is going to be what we're referencing for the remainder of our presentation. And how this presents physically, it's a lot of different ways. It could be irritable, stomach aches, headaches, heart rate will increase, a lot of sweating, a lot of avoidance tendencies, and things of that nature.
The etiology of generalized anxiety disorder is a combination of genetic, neurobiological, environmental, and psychological factors. Abnormalities in brain structures, particularly in the amygdala, nucleus accumbens, hippocampus, and prefrontal cortex, are associated with heightened anxiety responses. Neurobiological factors include neurotransmitter imbalances such as serotonin and gamma aminobutyric acid, or GABA, which regulate mood and anxiety. The environmental factors of early life stressors, such as traumatic experiences, abuse, or neglect, can contribute to generalized anxiety disorder in childhood and have lifelong effects. The family environment of over-involved parenting styles and the degree of support and stability at home can contribute to GAD. Social and peer influences, including peer relationships, social acceptance, and bullying, can impact a child's emotional well-being and contribute to GAD.
So now getting into the prevalence. Approximately 9.4% of children ages 3 through 17 in the US. This is going to be around 5.8 million individuals who have been diagnosed with anxiety. Females are twice as likely as male counterparts to receive the condition. Um, Individuals of European white descent are more prone to getting generalized anxiety disorder compared to those who are not white. Um, this is suggesting that non white backgrounds may exhibit greater resilience towards adverse childhood experiences compared to their white counterparts. However, it could alternatively imply that parents tend to underreport anxiety levels, possibly influenced by stigma and cultural concerns and things of that nature. Lastly, 0.9% more prevalent in higher income countries.
Some of the common challenges are sleep, social functioning, academic participation, social withdrawal, physical symptoms, negative self image, bowel urgency, attention and memory, and gastrointestinal issues.
So for our medical management portion, the only medication that has been approved by the FDA is going to be called duloxetine, and it can be prescribed for children 7 years and older with generalized anxiety disorder. There was a lot of side effects to this medication, just to name a few: nausea, insomnia, um, loss of appetite, fatigue, constipation, sweating, headaches, restlessness, suicidal ideation, diarrhea, just to name a couple. And then another method of medical management that has been proven to be beneficial for children with anxiety is psychotherapy, such as talk therapy.
The role of occupational therapy can provide assessment and individualized planning to understand the child's anxiety triggers, functional limitations, strengths by collaborating with psychologists and pediatricians, and the use of assessments as we are going to use in our interventions: sensory processing measurement, SPM2, or the COSA 2. So, the role of occupational therapy can create an individualized treatment plan through the use of assessments and gathering information from family and an interdisciplinary team. An OT can also use sensory integration techniques and frame of reference for sensory processing challenges that may contribute to anxiety. This sensory integration and frame of reference can provide sensory input and help regulate the child's nervous system, such as deep pressure activities, tactile experiences, and proprioceptive exercises. Using a cognitive behavioral frame of reference, OT can address the negative thoughts and behaviors that are affecting the child. This can be through teaching different strategies of emotional regulation, problem solving skills, positive self image, and relaxation methods. And the occupational adaptation frame of reference can be used to adapt the environment, such as a mindfulness jar and weighted blankets.
So this is our fictional client. She is a 6-year-old girl who has been diagnosed with generalized anxiety disorder. She is the youngest of 3 siblings. She lives with her family in a 2-bedroom apartment in Los Angeles with her mother and grandparents, in a Latin American household. She is in the 1st grade at her local elementary school. She's always been described as a sensitive child, but her anxiety has been more pronounced over the past year. She frequently complains about stomach aches and headaches, particularly on school days or before big social events, which result in her missing a lot of school. She has difficulty falling asleep at night and often experiences nightmares when she does fall asleep. Um, Her school teacher, Miss Kavaka, has noticed her lack of engagement with her peers, doesn't participate in class. Her parents have taken her concerns with the school psych, who had diagnosed her with generalized anxiety disorder. She has recommended outpatient OT, where she is seeing us now. It has been documented that Allie has difficulty concentrating on her schoolwork, maintaining attention in class due to excessive worry. She also exhibits a lot of social withdrawal, avoidance during social interaction with peers, due to fear of rejection or embarrassment, which has impacted her ability to develop friendships and participate in any sort of group activity. So for our short-term goals with Allie, Allie will engage in sensory motor play activity for at least 5 minutes per week with one peer with no more than 4 verbal cues and 4 interfering behaviors by the end of 6 occupational therapy sessions, as evidenced by parent and OT observation. Her second goal, Allie will engage in at least one peer during structured tabletop activity for a duration of 10 minutes using 4 emotional regulation strategies with no more than 3 interfering behaviors by the end of 3 OT sessions, as evidenced by parent and OT observation. And lastly, Allie will complete math homework for 30 minutes with no more than 3 breaks, utilizing 3 adaptive strategies within occupational therapy sessions.
The three occupations that are being worked on are homework, group participation, initiating sensory motor play with peers. The performance skills that are being addressed for homework are paces, attends, heeds, and inquires. Group participation addresses performance skills targeting endures, inquires, initiates, continues. And the third occupation, initiating sensory motor play with peer, um, with performance skills of approaches, looks, turns, towards, and regulates. The therapist utilizes cognitive reframing to challenge her negative thoughts of I can't or I'm scared and teaches positive coping skills such as I can do this or I am brave like Superwoman to manage anxiety provoking situations. Behavioral interventions like deep breathing exercises aim to alleviate physical symptoms. To support Allie's participation in daily activities despite anxiety, adaptation techniques are used. A mindfulness jar helps with adapting to challenges by teaching coping skills and promoting focus. Allie is redirected to use the mindfulness jar and to identify 3 things that she sees, 3 things she can touch, and 3 things she can smell. It is used to teach coping skills for managing stress, anxiety, or overwhelming emotions. Sensory integration activities such as swinging on the cocoon swing and riding a scooter board helps regulate sensory experiences and reduce anxiety symptoms related to sensory overload.
Here is our intervention video. Please enjoy. And this is our reference page. Thank you.